Hello and welcome back to the Aslan Health Podcast. I'm Dr. Mike Hauman. If you've been following the podcast, you know that we just finished a series on irritable bowel syndrome with diarrhea. Today, we slow down the GI train with a series on irritable bowel syndrome with constipation, referred to as IBS-C. And because IBS-C overlaps with chronic constipation, we're also going to address constipation care in general. Now, it may not sound like the most inspiring podcast topic, but when your bowels are sluggish, you are too. Your abdomen may feel bloated and tender, your appetite and mood may suffer, and your clothes may feel tighter as if you're trying to pack 3 pounds of sausage into a 1-pound casing. We're going to focus on what makes IBS-C and constipation care necessary and unique. Constipation as a pattern is multifactorial, involving gut transit time, hydration, fiber, nervous system regulation, pelvic floor coordination, your unique microbiome, methane production, your body's daily rhythm, and so much more. Constipation is not merely an elimination problem. There's often a communication and coordination problem as well. So, as the conductor for this show, I want to help you get your train moving, keep the track clear, and direct your future trains to run smoothly and on time. Well, it's time to leave the station. Let's get your gut train moving. Are you with me?
Welcome to the Aslan Health Podcast, where science meets soul. Your host for this program is Dr. Mike Hauman, an experienced physician, a certified functional medicine provider, a certified insight coach practitioner, and a devoted follower of Jesus Christ. If you're tired of feeling stressed out, exhausted, overwhelmed, or stuck in survival mode, you're in the right place. So take a deep breath. Let's be transformed by the renewing of our minds. Here's Dr. Mike.
Let's begin with a helpful analogy. Think about the plumbing system in your home. For a plumbing system to function properly, all the components must work in unison. Clean water must flow in, the pipes and drains can't be blocked, the venting system must allow excess air pressure to release, everything must flow in the correct direction, clean input, waste output, with a pump to maintain pressure and proper flow. When this system works, you rarely think about it. You turn on the faucet and water flows. You drain the sink, the basin empties. You flush the toilet, you get the picture. The whole system is functional, coordinated, dependable, and effective. But when something slows down or stops moving, you notice. Now, I want to be careful because your digestive system is far more sophisticated than a household plumbing system. Your gut is living tissue, guided by an incredibly complex interconnected system of nerves, muscles, hormones, immune signals, microbes, chemicals, enzymes, and of course, your brain. But the analogy is still useful. In constipation care, the issue may not be just one thing. There may not be a single clog, so to speak, to clear. Sometimes the inflow is poor, meaning that you're not getting enough fluid or the right type of fiber. Sometimes the movement is too slow, meaning transit time is delayed so that stool spends too much time in the colon, becomes dehydrated, firm, and difficult to pass. Sometimes the drain does not open well, which can happen with pelvic floor muscles if they don't relax or coordinate properly. Sometimes gas becomes trapped because the system is moving slowly or because certain fermentable foods are producing more gas than your body can easily move along. And sometimes the whole system's affected by stress, medications, thyroid function, blood glucose issues, or alterations in your gut microbiome. Think about it. You cannot solve every plumbing problem in your home by pouring more drain cleaner down the kitchen sink and pushing it with a plunger. Likewise, you cannot solve every constipation problem by simply adding more laxatives and using more force. Okay, I get it. But Dr. Mike, I'm often constipated. So where do I begin? Well, first, observe and ask good questions. Are you consuming enough fluid? Is your bowel moving too slowly? Is there a lot of gas production? Is your GI system coordinated properly? Is something upstream like medication, stress, thyroid function, microbes, or diet slowing the whole system down? Remember, Your gut, brain, muscles, nerves, microbes, hormones, and daily habits are all communicating to one another. That is what we're going to reveal today. Not just how to force movement, but to understand the system to wisely improve its function. Because when you understand your system, you can choose the right tool or the right intervention. And the right tool, used with wisdom, is far better than just turning up the pressure and hoping it will force something to move. Psalm 139:14 says, I praise you, for I am fearfully and wonderfully made. Wonderful are your works. My soul knows it very well. Friend, your digestive system is not crude, and it's not embarrassing to God. It's part of his extraordinary design. And when it's not working well, wisdom is not looking away in embarrassment or ignoring the issue. Wisdom is paying attention. Wisdom is seeing all of life from God's perspective, even constipation issues. So before we get too far, let me make one important distinction. IBS-C and chronic constipation are related, but they're not identical. Chronic constipation means that bowel movements are persistently difficult. They're infrequent, hard, incomplete, or associated with straining. IBS-C means that constipation is present, but abdominal pain is also a defining part of the syndrome. In IBS-C, bowel symptoms often occur alongside pain, bloating, and changes in stool form or frequency. So you can have constipation without IBS-C, or you can have IBS-C where constipation, bloating, and pain are part of that pattern. That distinction matters because treatment can differ between the two. If the main problem is IBS-C with pain and bloating, the plan may need to address gut sensitivity, gut-brain signaling, and a broader IBS-C therapy. This difference is one reason why just take more fiber is often incomplete advice and not the whole story. As we learned in the previous podcast series discussing IBS-D, Irritable Bowel Syndrome as a category is classified as a disorder of the gut-brain interaction. That means that the digestive tract may look structurally normal, but function, communication, sensitivity, motility, and rhythm are all disturbed. This is why a person with IBS may say, my tests are normal, but I do not feel normal. Normal tests and normal advanced imaging results, that does not mean that your symptoms are imaginary. It means that your doctor may need to look at function, pattern, and communication rather than only a structural, visible GI issue. In irritable bowel syndrome, where constipation is predominant, the common symptoms include abdominal pain, bloating, hard or lumpy stools, infrequent bowel movements, excessive straining, a feeling of incomplete evacuation, a sense of blockage, and sometimes the need to change position or press on the abdomen to help stool pass. Some people may defecate every day and still feel constipated because the stool's hard, painful, or difficult to pass. Others may eliminate 2 or 3 times per week and have no symptoms at all. So frequency matters, but it's not the whole story. The symptoms are important. The pattern, push, and pain matter. This is why the Bristol Stool Form Scale can be helpful. It's part of the download found in today's show notes. Think of the Bristol scale as a simple visual representation of stool form. It helps to categorize. Type 1 looks like separate hard pellets. Type 2, lumpy and firm. Those patterns often suggest constipation. Type 3 and 4 are generally more formed and uniform. That's what we're going for. Types 5 through 7 move towards loose and then watery. That simple scale can help you and your clinician communicate with greater clarity, more useful detail, and rather than saying, I'm just regular or I'm not regular. Because regular can mean very different things to different people. And on this topic, we need less confusion and more understanding to get things moving in the right direction for you. It is also important to have a correct perspective before you speak with your physician. Not to be fear-inducing, but wisdom-provoking. Most isolated constipation in and of itself is not dangerous, but some symptoms should not be ignored. So please promptly seek medical care if your constipation comes with rectal bleeding, blood in your stool, persistent or severe abdominal pain, fever, vomiting, inability to pass gas, unexplained weight loss, anemia, a family history of colon or rectal cancer, or a significant new change in your bowel habits. Friend, this podcast can educate you, but it cannot examine you. Your Creator made you for His unique purposes, and I want you to be cared for appropriately. Well, with that said, let's reveal what can drive IBS-C and constipation. If it helps, think of your bowel like a well-designed system of locks and canals. For a ship to pass through, several things need to happen. There must be enough flowing water, the current needs to move in one direction, there must be nothing blocking the path, timing must be synchronized, and the gates downstream need to fully open to allow the ship to pass through. In our example, constipation happens when one or more of those pieces gets disrupted. So, flowing from this analogy, let's review each contributing issue. The first driver is hydration, which is simple but often overlooked. If there's inadequate fluid in the system, nothing can flow. As I've said previously, fiber can help many people, but fiber without adequate fluid is like adding sawdust to wet cement. It's not helpful. The goal is not simply more bulk, it is well-hydrated, lubricated stool for easier passage. The second driver is motility. Motility is the organized movement of the digestive tract, or peristalsis. Your colon is not just a temporary storage tube. It is muscular, neurologically active, and coordinated. It contracts, relaxes, absorbs water, and moves waste towards the exit. When motility slows, stool sits longer in the colon, and your colon is very good at its job, so it continues to absorb water. As a result, your stool becomes harder and firmer over time. This can make it more difficult to pass. The third driver is fiber type. This is where many people get into trouble. They hear eat more fiber, so they start loading up with wheat bran, raw vegetables, beans, lentils, fiber bars, and high FODMAP foods. Then they become more bloated, more gassy, and more miserable. Friend, not all fiber behaves the same way. Some fiber is soluble and forms a gel, some is insoluble and adds bulk. Some is highly fermentable and can generate a lot of gas. Some's viscous, meaning it binds to water and helps to soften stool. I favor soluble fibers such as psyllium, partially hydrolyzed guar gum, or inulin. They're all a first-line strategy for IBS-C and chronic constipation in my book. I find fiber is the best place to start when introduced gradually and with enough fluid. Insoluble fiber such as wheat bran is much less reliable for IBS-C and can worsen bloating in many people. So choose fiber wisely and increase it gradually with plenty of fluid. The fourth driver is visceral hypersensitivity. That just means that the gut nerves become more sensitive. Two individual people may have the same volume of gas or content in the colon. One can feel mild pressure, and the other can experience significant pain. In Irritable Bowel Syndrome, the volume knob on gut sensation can be turned up. That does not mean that the pain is fake or exaggerated. It means that your system is more sensitive. The fifth driver is the gut-brain axis. We've discussed this issue in other episodes, so I won't repeat the whole lesson, but here's the constipation-specific point. When your nervous system is stuck in threat mode, digestion slows down. Remember, the parasympathetic nervous system is called the rest and digest system for a reason. So if your body is always sending the signal, we're under stress, this is not time for relaxed digestion, persistent stress can impact bowel patterns in the direction of chronic constipation. The sixth driver is methane gas. Some people with constipation have increased methane production by certain gut bacteria. Now, methane gas can slow intestinal transit time. This is one reason why a person with significant bloating, abdominal distension, constipation, and a poor response to basic interventions may need clinician-directed evaluation and treatment to reduce methane-producing bacterial populations. I plan to cover this in a future podcast as well. The seventh driver is pelvic floor coordination. Some people have an evacuation problem. The waste gets to the exit, but the muscles and signals do not coordinate properly to open the gate. Instead of relaxing and allowing stool to pass, the pelvic floor tightens, guards, or fails to release. In this scenario, if the pelvic floor is not coordinated, more fiber and more laxatives may not solve the problem. So if you experience worsening bloating with soluble fiber or fail to respond to laxatives, you should raise the question of pelvic floor dysfunction. The treatment your provider prescribes may include pelvic floor physical therapy and/or biofeedback, which can help retrain the muscles involved in passing stool. The next driver includes medical causes and medication effects. Constipation can be worsened by hypothyroidism, diabetes, high calcium levels, neurologic conditions, structural issues, and other medical conditions as well. It can also be caused or aggravated by opioid pain medications, iron supplements, anticholinergic medications, some antacids, calcium channel blockers, antihistamines, diuretics, and some antidepressants. That means constipation care should include a review of your medications and supplements by an experienced medical professional. Sometimes your gut may not be failing, it's just responding predictably to a product that you take every day. The final driver is your body's daily rhythm. Your biological system, including your gut, has a natural rhythm. Your colon is often more active after waking and after meals, especially breakfast. This is called the gastrocolic reflex. But modern life is so busy that sometimes we ignore the urge. We rush through the morning, we skip breakfast, we hold it in because we're too busy. We sit all day, consume minimal fiber, drink too little water, and live under continual stress. Then we wonder why our bowels have lost a regular schedule. Friend, the human body loves rhythm. Regular meals, adequate hydration, daily movement, and a consistent, unhurried bathroom time can all help you restore a healthier digestive cadence. As we close this episode, I want to discuss one final thing. I need to reveal the elephant in the room, so to speak. The potential here for shame. I recognize that a conversation on constipation can make many people feel childish, embarrassed, and uncomfortable. My friend, do not accept that feeling. There is no shame here. You are a wonderful person made in God's image. You have a body that's attempting to provide you with signals and helpful information. That information is not criticism or condemnation. It's not suffocating or shaming. It is an invitation to wisdom. Proverbs 20 verse 5 says, "The purpose in a man's heart is like deep water. A man of understanding will draw it out." Obviously, that verse is not about constipation, but the principle applies to health. Sometimes the causes of our physical issues are deep. Sometimes our patterns are not obvious at first glance. That is when a person of understanding patiently draws them out. That is what we're doing in this reveal episode. I'm encouraging you not to panic or guess wildly, but to carefully observe your pattern. So, your practical assessment this week is simple. Grab the log and the information from today's show notes or subscribe to the free Aslan Health Weekly newsletter for your own copy of that log directly into your email box. Then, for the next week, write down your bowel movement timing and frequency, your Bristol stool type, how much you strained, your pain and bloating level, your food, fluid, and fiber intake, your supplements, sleep, and stress. And also note that if you ignored any urges to go. Do not judge, just observe. Reveal your own personal pattern. Not to criticize or chastise, but to understand your starting point and to see more clearly what your body is asking for and how to reveal where you may be stuck. So as we close today, remember this: constipation is common and IBS-C is real. Your pain and bloating are not imaginary. And friend, a stuck gut does not mean a stuck life. In our next episode, we'll reset your constipation with practical, evidence-informed whole person options that can help you move things along. We will talk in detail about what to stop doing and what to start doing, and how to build a stepwise constipation care plan that is wise, safe, and practical. Until then, begin with observation. Pay attention, write it down, pray for wisdom, and bring your body before the Lord without shame. He loves you and designed you uniquely with great care. This is Dr. Mike Hauman. Thank you for joining me today on the Aslan Health Podcast. Until next time, may your mind be renewed, your body strengthened, and your heart guided safely by the one who made you, knows you, and cares for you completely. His blessings to you, my friend.